Hi everyone, I'm Wendy Netter Epstein from the DePaul University College of Law, and I'm going to preview for you a talk that I'm going to give to the students at the Health Law Policy Workshop at Harvard Law School on November 2nd. This project with my co-investigator Christopher Robertson of Boston University is still in the early stages, but it's going to be an experimental field test that we're teeing up where we're looking to test innovative mechanisms to address the United States uninsurance problem. We're particularly keen to get your feedback. You can find us on Twitter at @ProfWEpstein and @ProfCRobertson, and then feel free to also reach out to me by email at wepstein@depaul.edu. And I just want to flag as well other team members, Hansu Ko from the NYU Wagner Graduate School of Public Service, and the Policy Lab at Brown University is going to be supporting this project. We also have involvement from 3 different states that we're collaborating with on the field test component of this project. So let's talk about uninsurance. As everybody knows, we have this kind of crazy fragmented system in the United States, and we've tried to fill in gaps in insurance coverage by doing things like expanding Medicaid and giving people subsidies to purchase insurance on the healthcare exchanges. But there are still a whole lot of folks who are uninsured, and unless we get a universal coverage program, that's going to continue to be the case to a certain extent. But we want to see what we can do to try to improve upon it. So you're looking now at some of the data on the uninsurance rate. These are really the same thing, these 2 graphs. One is the percentage and one is the number of uninsured Americans in millions. And what it shows is that after the Affordable Care Act was implemented, the uninsurance rate did fall pretty drastically from a high of 15.5% to a low of 8.6% in 2016. What that means is that 20 million people did gain insurance because of the Affordable Care Act. But in the years following 2016, we've seen it chipping away at the Affordable Care Act protections. That number has started to tick up again. The question, though, is what's going to happen now that we are in the middle of a pandemic and an attendant recession that has come with it. And I think the truth is that we don't fully know what the impact is going to be, but there's reason to be concerned. So, of course, more than half of people in the United States still get their health insurance coverage through employers. So the fact that so many folks have lost their jobs during the pandemic, even though that's starting to improve a little bit, gives us reason for concern. There are new affordability concerns because of people losing their jobs and then the other recession-related aspects of the economy. We might see an increase in Medicaid coverage, and actually early data has suggested that that's already occurring. So some of the loss that we're seeing in some of these other areas might be offset by an increase in Medicaid coverage. But although the estimates vary pretty widely in how many more people are going to be uninsured in 2020 than in 2019, the CBO is the most conservative side of the estimates at 3 million additional uninsureds. Other studies suggest it might be as many as 8 million additional new uninsureds. Either way, this is not a good thing. So I've been thinking for a while about this problem of uninsurance, and in a paper that I just published earlier this year, I engaged in what I sort of consider a thought experiment. And the principal conceit of this paper is that usually when we're talking about ways to increase insurance uptake, we're focusing on affordability and on cost. And those are certainly good places to start. That's always the #1 reason that people give for why they don't have health insurance. But it's not the only reason for why people don't have health insurance. And in fact, there are a number of behavioral biases that contribute to people not having health insurance. So you'll see answers on surveys that are asking folks why they don't have health insurance, where people say that they don't think that it's a good value, or that they don't think that they're going to need health insurance. And so I wanted to start thinking about ways that we could address some of these behavioral biases. And just for purposes of our talk today, I'm going to focus on 2 particular possible interventions. One is generosity framing, and the other is what I'm calling a return of premium policy or a rebate. Okay, so the generosity frame is basically changing the message that you send to people for why they should get health insurance. So right now we tell people this is an economically rational thing to do, to protect yourself, to get a policy. But healthy people are subsidizing the cost of sick people under the model of the Affordable Care Act. And one possibility might be to be more honest about that and to tell people that that's what's happening. We know that people are very supportive of the protections for those who have pre-existing conditions and want people that are sick to be able to get access to affordable health insurance. And so if we tell them that you have to purchase health insurance to make that possible, that may have an impact. This plays on people's desire to be generous and altruistic. And of course, this is a marketing tactic that we've seen in other areas. It's been successful. I'm giving you the examples of Tom's shoes and Bombas socks on the screen, but also in the, with the green halo effect in the environmental space as well. And the other intervention that Christopher and I are looking to test is this return of premium policy idea. And this builds on the work of Tom Baker and Peter Siegelman. I've given you the site at the bottom of the slide, but also really borrows an idea from the life insurance space. And what it says is, this is directed to the people that think that they don't really need to use their health insurance. It says, get a policy just in case, and if your utilization is low, below a certain threshold, exempting preventive care that we want people to get, then we'll give you a rebate or we'll give you a return of some of your premiums at the end of the policy term. So we did run a pilot study. This is giving you data on some other interventions as well, but I want to focus on the generosity and return of premium. And this was a vignette style online study, a 5-by-1 blinded study of people who actually don't have insurance. And what we did was we presented them with a policy and we asked them how likely they were to purchase the policy that we presented. So if you look at just the first two green bars on the left side of the screen, the base and the generosity, the only difference between those two interventions is in the way that we describe the reason for purchasing the policy. The cost of the policy, the benefits of the policy, everything was identical. But with the generosity frame, we told people that it was the generous thing to do and that by buying a policy, they would be making it so that somebody who is sicker is able to afford a policy. And you can see that a higher percentage of people were interested in buying that policy than the base case, even though economically speaking, those policies were identical. And the return of premium results were also encouraging at 50% as compared to the 42%. This was just a very early pilot study. Only 551 respondents were tested. So we want to build on that work. And the first thing that we want to do is to do some qualitative work, run some focus groups, try to further refine the proposals, better understand how we can describe these interventions that's salient to folks. And then we want to repeat the vignette study with a larger sample size and see what sort of results we get. And really we're working towards ultimately running or conducting a field study with our state exchange partners. We've been focusing a lot on the generosity frame because that's something that's pretty easy to test since we just changed the way that we are marketing essentially the exact same product. But we also want to talk to the state exchanges about about offering a new product that looks like the return of premium or rebate idea. Very excited to hear everybody's feedback. Again, this is how you can reach us. Thanks for listening.